DRC has begun a mass Ebola vaccination drive. 4 new cases and 2 deaths have been confirmed since the resurgence of the virus was declared on the 7th of February. The country was declared Ebola-free in June last year after an outbreak killed more than 2,000 people. UNICEF is now in the area to prevent the virus from spreading even further. Joining us now is its DRC Senior Coordinator, Jean Metenier. Very good morning to you, Jean. Tell us what it is that you have seen. I believe you've just come back from the area that's been affected. What's happening there?
Yes, I just come back from Butembo, where the resurgence of the Ebola has been observed. Today we have now 4 cases, including 2 deaths, and the international, the implementing partners, especially the health authorities, together with the international community, is fully mobilized in order to try to put in place a number of measures in order to prevent the expansion of the Ebola outbreak in Butembo. This is it's a big concern because this is a resurgence of the 10 epidemic which took place between 2018 and 2020, and new cases in a very difficult terrain is a challenge because we are facing numbers of security concerns with the presence of armed groups in the area where the first cases has been observed, and in order also to mobilize all the resources which we need in order to stop the transmission of the disease.
Tell us a little more about the disease. Excuse me jumping in here. I know in DRC you have these ongoing problems, the security concerns, the fear of people, what's been administered. How quickly can this spread? What's the danger here? What are we looking at potentially?
Well, potentially, the first case was identified only when the person died and has been hospitalized in 2 different structures without knowing that the person was contaminated by Ebola. So there is a number of contact cases which are at high risk of being infected by the initial patient. And so now what is the challenge is really to ensure that we are putting in place the tracking of all the contacts in order to see if they are going to develop the disease or not, and ensure that they are going to receive proper treatment. We are also looking about the vaccination in order to vaccinate all the contact cases as well as all the medical staff in the structures where the initial patients has been hospitalized.
All right, and do you have the medication that's needed for this, particularly when it comes to the vaccine?
At this stage, WHO has been able to mobilize numbers of vaccines in order to do the initial vaccination. Of course, the quantity of vaccines which we have is limited, and we hope that additional vaccine would be mobilized by WHO as quickly as possible. We have the medicines in order to treat the 2 people which are still hospitalized with Ebola, and we hope that with the protocol which has been put in place, we are going to be able to treat them and to free them from Ebola.
All right, Jean Metenier, very good to talk to you. Thank you for highlighting this for us and the amazing work that you do.